presentation on a systematic review that I performed with Dr. Steve Karras, who just presented. So obviously different type of research as compared to the case study that he just talked about. So you guys are here to hear about upper quadrant research. This is actually on pain pressure thresholds and spinal mobilization. So not sure how we got in this group, and sorry to disappoint you if you're here to hear about upper quadrant research. So an introduction on spinal manipulative therapy. Obviously, you guys are manual therapists. You guys like to mobilize. You like to manipulate. But we're not truly gaining a great understanding of what's happening. We all say that there's neurophysiological as well as biomechanical responses from those interventions, but not a lot of great research on what's actually happening. So what we wanted to do was to take a look at the research on pain sensitivity. In particular, what happens with pain sensitivity when you mobilize. In 2009, Dr. Joel Bialowski found that after spinal manipulation, so a grade 5 thrust, there's a change in pain sensitivity. We went to look, is there a similar effect when you mobilize somebody? So the purpose of this systematic review was to analyze the relationship between non-thrust spinal manipulative therapy and improvements in pain sensitivity via pain pressure threshold. So our research design and methods, we use PRISMA guidelines to help us conduct this systematic review, as well as to help guide us in what type of studies and how we should be reviewing those studies. We reviewed literature in all of the major databases over a 15-year period. Our search results initially brought up 1,110 articles. We were eventually able to narrow that down to 10 articles that met the inclusion criteria. For our quality assessment, we utilize sources of risk bias tool by Cochrane, as well as the grade method proposed by Cochrane for looking at the quality of evidence. So what were the results? In 7 out of the studies that we analyzed, pain pressure threshold values improved after non-thrust manipulation. And this is really important for supporting that neurophysiological effect that we think occurs when you perform manual therapy. From a systematic review, we believe that there is sufficient evidence to suggest that pain pressure thresholds increase immediately following non-thrust mobilization or manipulation. But one thing that I want you guys to think about, especially the clinicians in the audience, what does this really mean? Okay, so we have so many randomized controlled trials that are looking at the immediate effects of things. But does that result in a good clinical outcome? What is the long-term effect from that immediate response? Because I want to point out, from that 1,110 articles, we narrowed down to 10 that simply met the criteria for our inclusion. Everybody was looking at the immediate effects of something. So we need to look at what's happening long-term when we get those immediate results. If you look at some research by Cook et al., in 2012, 2013, they found that the within and between session changes were able to predict long-term outcomes. You know, this may be what's going on, but we would like to see some more research in that domain. So some limitations that I'd like to discuss. 3, that actually should be 10, that's a typo. Studies performed only within 1 session. So they simply looked, again, at those immediate results. 3 other studies that we used was looking at pain sensitivity in the cervical spine. So is this applicable to other parts of the body? None of these studies in our systematic review used any other form of physical therapy interventions. They used non-thrust mobilization only. And there's questionable applicability of clinical practice, because how many of you guys are using the algometer and truly measuring pain sensitivity? So even though we know this is going on, we think that it may explain why some of these results are occurring. You guys may not actually be measuring pain sensitivity clinically. So we think that there may be implementation down the road and support for implementation of pain sensitivity measures, but it may not be happening currently. Okay. Thanks for your guys' time.